don't work that much differently than cocaine. If you were to give an intravenous bolus of methylphenidate, which is Ritalin, and you were to also give an intravenous bolus of cocaine to the same individual, the exact same areas in the brain light up. They almost look indistinguishable. So the truth is we're giving kids powerful stimulant drugs that work not much differently than cocaine. And we think that this is a good approach to their mental health and well-being. It's not. They definitely would do better on good, solid nutrition, which could involve really eating better, just general guidelines on better eating, less processed foods and less junk food. They would definitely do better on the judicious use of optimal micronutritional interventions, which could involve anything, whether it's B vitamins, whether it's vitamin C, whether it's niacin, whether it's magnesium, whether it's zinc, and so on. It would have to be individualized. And we also have to change the learning environment that they're in. We also have to help families. Communities need to support families because you know what? It's really hard raising children. I have 3. It is incredibly challenging. But the credit that I would give goes to my wife. She's created a community that supports her when she needs it, and she supports other mothers in the community that need her help. So we have to start actually, energizing and mobilizing the people who live within our communities to help us because it is really challenging, and we all could use some extra help. But ultimately, if we're not going to do all these different processes, then the only paradigm of care is going to be what the paradigm of care is today, which is drugging children. And I am highly ethically opposed to it. It breaks my heart, and I think we really ought to consider many other options, which unfortunately is not the norm. Most parents, because they are born into this very medically dominated world, they come to believe now that the only option is drugging, and that somehow it's fixing a biochemical imbalance. The only imbalance it's fixing is the imbalance that the parents feel because they're overwhelmed by their life. But in other words, it's not actually fixing anything. It's creating an imbalance. Psychiatric drugs do not correct anything. They disturb and actually impair normal brain processes. So it's their brain-disabling properties that de-intensify symptoms. But that's it. They're not correcting anything that's defective in the person who's given the medication. There's no defect in a child who has ADHD in that child's brain. It's never been found, and it never will be. The only defects that are found are kids who are on medications. That's when you get different changes within the brain and different changes to how the brain functions. So to me, we're creating brain-damaged children to some degree, and we're not giving them kind of attuned, empathic, social, nutritional, all the different avenues that they need. We're not giving them at all. We're only thinking that this one size fits all, and there's no way we're going to advance our young in any reasonable manner if this continues to be the only paradigm of care given to them. So when a clinician who uses nutrients, micronutrients to help patients, evaluates a patient, that patient is given a very individualized treatment. That patient is given the respect for being a unique and different human being. When a patient is seeing a psychiatrist, for example, they're not appreciated in that way. Their life is now deduced into, or I would say reduced, to what psychiatric label that patient has. So all of the context, all of the subjective experience of that person becomes narrowed down to search for a particular diagnostic label. And then treatment then results from that label. Now there's several problems with that approach. Number one is there's very poor inter-rater reliability. So if you were to go to a psychiatrist with some depressive and anxiety symptoms, one psychiatrist may say you have major depressive disorder, another psychiatrist may say you have generalized anxiety disorder, another psychiatrist may say that you have bipolar type 2 disorder or bipolar spectrum disorder, and so on and so forth. So the reality is, because no one's concerning themselves with the subjective experiences that people bring to their care providers in a manner that actually is attuned and caring, like we have to really care for the people we treat, what happens is we're reducing that human suffering to what label we can provide. And based on that, we're giving them very, very imprecise treatment. Now that is considerably different than the work I do. I want to hear about somebody's experience. I want to understand somebody's problems. I also want to know about their strengths. I mean, everybody has strengths. It's incredible to me that we only focus on deficits and we don't think about all of what a person has when they see a doctor. So I care about somebody's actual strengths, and you have to really understand an individual before you can really provide good treatment. And what I love about the work that I do is I can individualize all the nutritional treatments and other treatments that I give my patient based on understanding them. And I don't think the modern system really cares too much now about understanding people. The modern system is really mostly interested in figuring out what it is that somebody has in terms of what label we can give them. And then based on that, we just give a set of drugs.